Hello and welcome to MedNeoClasses. So the focus of today's interaction is laryngoscopy. Okay, so laryngoscopy basically is a medical procedure used for the visualization of or to examine the larynx, sometimes called as the voice box, and surrounding structures. Medical procedure used to examine the larynx or voice box and the surrounding structures. It is commonly done to view the vocal cords. Okay, to view the vocal cords, to check the airway patency, to diagnose the throat problems, okay, and to assist in the endotracheal intubation. These are the things for which laryngoscopy is commonly done. In the types we have got the indirect laryngoscopy and the direct one. Indirect laryngoscopy is done for the basic examination, okay, done usually in the OPDs under the local anesthesia, okay. Small mirror or some fiber optic scope is used to view the targeted structures where we basically want to view. In the direct laryngoscopy, sometimes loosely called as DL, it is done in the surgery and intubation, okay, done under the anesthesia. Here we have got the clear and magnified view with the help of a variety of laryngoscopes, which include the common laryngoscopes with McIntosh blade, Miller blade, and of course the video ones, which include CMAC, McGrath, and fiber optic. So the normal steps of an endotracheal intubation, if we start with the nose, then into the oral cavity, goes into the oral cavity, and the tongue is lifted with the help of laryngoscope blade, okay, then vocal cords are visualized, and finally the tube is placed in the trachea and thereafter secured at an appropriate length. Okay, these are the steps of an endotracheal intubation. Endotracheal intubation is usually done that in a position which is called the sniffing position, okay. In sniffing position, neck and head are slightly flexed and extended respectively, okay, which this position is achieved basically by inserting a small pillow between the below the neck and head, okay. Then in the indications, we have got the laryngoscopy is done during the suspected vocal cord lesions like the polyps, nodules, okay. If the patient has got the continued chronic cough, continued throat pain, okay, airway obstruction, then laryngoscopy is performed. And of course in the airway management or endotracheal intubation, which we commonly call in the OTs, okay. And then for the removal of foreign bodies, these are the indications for which the laryngoscopy is done. Then in the complications, it induces a variety of complications in the patient, which include spasm like the laryngospasm, bronchospasm, okay. Aspiration risk is of course there. Then cardiovascular complications like tachycardia, hypertension, arrhythmia, these are all the cardiovascular complications induced by the laryngoscopy, okay. Then of course the dental injury and injury to vocal cord. For more such informative videos, keep supporting and watching MedNeoClasses. Thank you.